Lauren, thanks for coming along to see Dad and myself.
That's okay. What's been happening?
Oh, just since you last seen us, Dad's just been a lot more unsettled, wandering around a bit, and hasn't been going for his walks at all.
Okay, so that's quite a big change. What have you been noticing, Phil?
No, I don't feel like walking anymore.
You don't want to walk?
Yeah,
okay.
he probably hasn't walked for about 6 weeks, and when we ask him, he gets quite snappy with us, doesn't want to go.
Apart from your walking, Phil, what else have you noticed? Have you noticed anything else? No? Okay, all right. There might be a few reasons for this, but one reason might be pain. Do you think you've got pain, Phil? You don't notice pain at all?
No, he's never complained of pain.
Okay. Sometimes pain can be expressed in different ways. I know if I've got pain, I might not tell people, but I might go to bed or lie a different way.
Yeah.
And I guess we're all like that. One way that we can work out if somebody has got pain is through the use of a tool, and there is a tool and it's called the Abbey Pain Scale. So if it's all right, we might go through that and we might actually see if we can use the tool for you, Phil, to see if we can work out whether you've got pain or not, if that's okay.
Is that all right with you, Dad?
Yep, that's okay.
It's worth a try.
So it just looks at different areas and different changes that pain might cause. So the first one is vocalization. And when we're doing this, we need to think about, Phil, when you're up and you're moving around, because when you're sitting, the pain might not be there, but when you're actually moving, it may be present. So if we think about when you were walking back from the door when you came out to greet me, think about how you were feeling at that time. So the vocalization is the first area. Groaning, moaning or crying, any changes there that you've noticed?
Not that I've noticed.
No? Okay. So that's a 0 is the score. The next area is facial expression. So sometimes if people have got pain, they may have a change in their facial expression, frowning or grimacing, or even looking quite frightened or tense. So I'm not sure if you've noticed any changes with that area.
Probably frowns a bit when he goes to get out of a chair, when he pushes up.
Actually pushes up?
Yeah.
Okay. And these questions are more for what people are noticing, but it's good that you're thinking about it as well, that you're aware of what's happening. So we'll probably give you a 1 for that. What about a change in body language? That might be fidgeting, rocking, guarding a part of the body.
Well, he doesn't really sit still a lot, so.
Okay, and that's new?
Yes, definitely.
Yep, okay. So we'll give you a 1 for that area. The other area is a behavioural change, and we've already spoken about not going for walks, which is a really big change. What about other areas? So not eating, an increase in confusion, not doing the normal tasks that you'd normally do. Is that something that you think is more than just the walking?
You really haven't wanted to eat much lately, have you, Dad?
No.
It's really decreased on his food intake.
Okay, so we'll probably give you a 2 for that area. Now the physiological change, sometimes if the pain is really quite extreme, we can see a change in the pulse or blood pressure. And we know that your blood pressure and pulse is quite stable, so that's good. So we'll give you a 0 for that area. And the last area is actually a physical change. So have you had any skin tears or injuries, or even have you got arthritis or any previous sort of pain-related diseases? So you've had arthritis in the past?
In my knee.
In your knee, okay.
Yeah, he's got bad knees.
Bad knees, okay. So we'll give you a 1 for that. So we actually, adding those up, have a score of 5, which is actually indicating some mild pain. And it might be pain that's not severe, that you've probably lived with before. So it's good that we just assess and work out what level you're at. What we probably need to do now with that score is think about initiating some regular paracetamol, because you were taking paracetamol before, is that right?
Yeah, but he hasn't taken anything for a while now. He's on no pain relief.
No pain relief. I probably think that what we might need to do is start some regular paracetamol. I'll leave you some copies of the Abbey Pain Scale so that you can do them a few times over the next couple of days. And I'll probably come back at the end of the week,
Yep.
and we'll have a look and see if the paracetamol has actually reduced the pain score.
When would I do it? Like before pain relief, after?
You can do it before the pain relief just to see what the level of pain is at, and then you could probably do it an hour after the pain
Okay.
relief has been given to see if it's effective. And with the paracetamol, it'll take a couple of days to sort of get the full effect, so that's why we like to do it in a couple of days' time as well. So I'll come back at the end of the week and we'll see what's been happening, if that's all right.
Yeah, that sounds great. You happy with that, Dad?
Yeah, that's good.